Prime Minister demands COVID acquittals from PHAs. 8 out of 10 are COVID infections in NCD. And former Health Minister calls for lockdown.
This is National EMTV News with Helen Seah.
Good evening and thanks for joining us for Friday's news. Former Health Minister and doctor by profession Sir Puketemu has called for a lockdown in light of the current COVID-19 situation, the Delta variant surge in the nation's capital. He made the call following the announcement by NCD Governor Puss Pakup, who had opted for vaccination instead of a lockdown. Sir Puka says the recent media reports on the COVID situation in the capital city should be evidence enough to impose a managed lockdown.
I want to say that I was not happy with the governor's decision yesterday because it's very, very clear to everybody that the current wave, particularly in the areas that the news has been reporting on, and now in NCD, is really causing a lot of issues to all of us. Firstly, the death of many citizens in the city and in the country. And also the Port Moresby Drau Hospital CEO did report that 2 children have now died of COVID. And also it's very, very visible in the NCD and reported very well by the media and all of you that the beds are really packed. Staff are really stressed. The mortuary is really full, so they're extending mortuary space, they're extending bed space, and they're asking for staff for relief. That is enough evidence that the system is fully stressed. That is because every day, as you have been reporting, every day cases are coming in. The ambulances are doing 5 times more calls than they've ever done before. The emergency staff are seeing more emergency patients than they've ever seen before. The mortuary staff are seeing more death than they have ever seen before. And so what more do you need? And my call to the governor is, while I agree that the vaccination push is the way to go, that will not solve the immediate problem of the systems being overstretched. We need some relief. And because all of us know that COVID moves from person to person, as people move, as crowds move, then COVID moves. And so the world has demonstrated, and we're very close neighbors, Melbourne and Sydney, just down the south, that lockdowns do help. I'm not saying the tightest lockdown. No, there is a managed lockdown. For example, emphasize on controlling the crowds where the crowds are. Last time that the NCD engaged the police personnel, I was always very happy that the police personnel had tents outside where the crowds were going. And there was very good control. This was only about 3 months ago. That's the type of thing I'm talking about. That where there are crowds, the social distancing orders cannot be met without police presence. Because our people are traditionally social beings. And so when you just give an order without policing it, people never listen. And we know people have never been listening. This is why the wave, particularly with Delta variant, we are in real trouble right now. So I really feel sorry for the health staff who are there 24/7. I really felt sorry for not only for them there all the time, but mentally and spiritually. They are really, there's a lot of pressure on these human beings called health workers. And so I believe that the way to help at this stage, next 2 weeks, is to have a lockdown, a managed lockdown. And particularly buses, control how many passengers, churches, stop going to church. Just go pray in the house. Public servants, you have to do phased work. Some staff, 20 staff come in the morning, mid-morning, next in the night. Those type of things can be done. Hotels don't have to close because they're doing very well. Supermarkets don't have to close because they're doing very well. No mask, no service. So those are already there, but in particular is where big crowds are still gathering. No more sport activities, no more gatherings, and orders are already there, but NCD, where the governor is in charge, is failing to police those orders adequately.
And to a COVID-19 story from abroad, the pandemic will drag on for a year longer than it needs to because rich nations won't share enough vaccines with poor countries. The World Health Organization is criticizing the COVAX scheme, which is supposed to ensure equitable access to the vaccinations.
It's the question we all keep asking. When will this pandemic end? Not as soon as it could is the answer from the World Health Organization because of uneven vaccine distribution across the world. There have been plenty of summits about vaccine donations to poorer countries, but the exasperation of WHO officials is clear to see.
We need a stock take. The G20 will meet at the end of October. We need them to say, where are we against those commitments? And I can tell you today, you're not on track. You need to really speed it up. Or you know what? This pandemic is going to go on for a year longer than it needs to.
COVAX was the international programme set up to ensure all countries, both rich and poor, could get enough vaccines to cover at least 20% of their population. But it hasn't worked out as planned. The vast majority of vaccine doses administered have been in richer countries. Africa especially has been left behind. A new analysis from a group of charities called the People's Vaccine Alliance shows the huge gap between what the world's richest countries have promised to give the poorest versus the number of doses delivered so far. The UK and Canada have been singled out for particular criticism as both countries acquired some vaccines from COVAX for their own populations, even though they had their own supplies.
On the one hand, every country that joined the COVAX facility was entitled to obtain vaccines. But these two countries obtained many, many doses through bilateral agreements that could best be characterized as hoarding. So the idea then that they would double dip and take more vaccines from the COVAX initiative really is morally indefensible.
The latest warning from the World Health Organization is that the pandemic will continue deep into 2022. It's urging pharmaceutical companies and wealthy nations to make sure low-income countries are now prioritized in the queue for life-saving vaccines.
You're watching National EMTV News. We'll have more stories after these messages. Stay with us. Welcome back. Prime Minister James Marape is calling on all provincial health authorities to submit their plans to the government by next week. Failure to do so might see a change in the PHA management. This warning comes as the government, through the health sector, struggles to reduce COVID-19 cases and deaths.
Prime Minister James Marape has warned a change of the Provincial Health Authority management if the PHAs don't submit their COVID-19 reports and hospital plans to the government by next week.
I've asked our provincial health authorities to send in their reports and send in their plans. Today, as I speak, I've only received from Eastern Highlands and Western Highlands. Now, there's a call to all provincial health authorities. Get your report coming in. I've already directed the health secretary. If some of you do not send your plan in by next week, we are looking seriously into ensuring that you respond. And if you don't respond, well, please, we may as well replace you. This is no light moments. Our country is in red zone in as far as COVID-19 is concerned. There's a call placed to all our provincial health authorities right throughout our country to send in your plan. Our government stands ready to demobilize resources to support your provincial plans in your response to fight COVID-19 by immediate care, medium-term care, as well as a long-term plan.
The Prime Minister, through a virtual media conference this afternoon, says based on the reports, they will help the hospital depending on its needs.
For me as a government, we want to ensure vaccine is available on the shelf, but going forward, we're working with our provincial health authorities to ensure we build up capacities in our provinces, and I give commitment to our country going forward this year. And next year, we will be expanding bed spaces, ensuring that the beds we build in our country has oxygen attached to it, and the clinical care aspect will be looked at by our government as never done before to ensure that those who are sick, we are able to attend to in as far as medical care is concerned. And this is something that we're trying to do. I've already asked our finance and planning and treasury team to sit with health department to ensure we unlock resources to support provincial health authorities to ensure the actual healthcare system is built up to handle a possible blowout of COVID-19 into the future.
An urgent meeting will be held this Sunday with all stakeholders to see how they can chart the way forward in combating this health crisis.
I'm calling a combined NCC, defense, police, treasury team, finance team together to look into how we could unbundle resources to support the health sector in a big way going forward. And from that meeting on Sunday, it may mean that we may ask for the nation to step up in as far as the isolation strategy is concerned.
The Prime Minister, while he respects individuals' decisions to not get the vaccine, he is calling on Papua New Guineans to be responsible, stay home if you have to, and get the vaccines to minimize the deadly risk of COVID-19.
I want to encourage our citizens. Safety of yourself, safety of your family, safety of your community, and safety of our country is totally dependent on our attitude, on our response to ourselves, to our family, to our community, to our country. And it is important at this time, we must all know that the Delta strain of COVID-19 is now amidst us and is spreading. And so community must be able to promote nucleopacin, stay safe away from crowd, stay safe in your own home setting, go to work and follow the nucleopacin and work protocols that is expected of each and every one of us to ensure our country remains in defense to the spread of COVID-19. And please, I encourage once again, vaccine is available. Assist your natural immunity with an added boost by taking one of the 3 vaccines that we've allowed for.
Meanwhile, the Prime Minister said the country should expect some new COVID-19 measures next week aimed at limiting the movement of people. Shamin Poriambeb, National EMTV News.
Prime Minister James Marape says the report on the use of COVID-19 funds will be made in November. He said at present there are still outstanding acquittals yet to come in.
Funds have been spread in 3 or 4 different sort of disbursement points through the health department and the PHAs, the operational sort of expenditures at National Control Center, and then the districts and provinces. So these have been the main sort of areas where funds have been disbursed. We've asked for acquittals. Some have acquitted, some have not been sending in the acquittals. It's a work in progress, and as I said, for me, going forward, the next round of disbursements will not be distributed to the districts or provinces, but will be passed through on a plan that we approve. This plan will involve additional bed spaces, the capacities like oxygen and PPEs, etc. So each provinces through their provincial health authorities have been asked to send this in, so that we know what we're funding to achieve a healthcare system that is able to support a pandemic that is now blowing in our face.
It is becoming more likely that a lockdown of the nation's capital is imminent. NCD Governor Paul Pakop says he is waiting for the health authorities and the police hierarchy in the city to advise him if the option of lockdown is possible. Governor Pakop added that with the rate of infection at 8 out of 10 infected with COVID-19, a lockdown is imminent.
With a daily surge of COVID-19 cases in the nation's capital, the likelihood of going into lockdown is starting to look like the best option to control the spread of COVID-19. Governor of NCD Paul Pakop says he is liaising with the relevant health authorities, including the police hierarchy in the city, to confirm if there is a need for a lockdown once more in the nation's capital.
We are talking about it now, the lockdown. I have discussed with ACP Wagambi and Metsupi Kumu. I've discussed with Dr. Sapuri, who is the chairman of the PNG Medical Board. I'm waiting for Secretary Health and our three CEOs to give their opinion today. Yeah, I'll keep pressuring them today.
Lockdown has been at the back end of discussions and is seen as the last resort towards clamping down on the spread of the virus. Pakop, who has been championing the vaccine campaign in the capital city, says that people have become complacent and have been ignoring the simple measures that could prevent the spread of the virus.
I want to appeal to our people. It's really up to them in the city. If they self-regulate themselves, wear masks, not go along house crying a boom boom number. That's how we do a big spread, how we transmit. Because virus Ronnie Goy come. We carry it around. So if we stop going around and stop all the house cry and stop all the booms or stop all the big gatherings, then we will break the transmission. Then there's no need for us to go to a lockdown. But if we don't do our part, and number of patients going to the hospital and the other facilities, it gone up. And by me no got choice now, yeah.
It is evident that the city is highly dependent on the cash economy, and a lockdown would see a breakdown in the exchange of cash for goods and services. That is the worst scenario that could see people suffer with no regular daily income.
We cannot make the same decision for the provinces or for the rural areas as in the city. Yeah? I am very, very sensitive to the effect it could have on our livelihood of our people because they depend on cash. And the government doesn't have cash to give to our people at this time. So as much as possible, I don't want the restriction to affect the capacity of our people in the city to earn an income.
The municipal government of the city has taken a three-step approach to counter the spread of the virus.
Three-pronged strategy. Do the vaccination rollout, get the medical people to have the capacity and ability to deal with those who are infected and end up in the hospital or the medical facilities, isolation centers. And our people do their part too by respecting the COVID protocol. If they could, self-isolate themselves, stay home, don't gather in big numbers, it will really help our effort.
But at the end of the day, it is a choice that each individual has on what rules and protocols they wish to follow. Otherwise, lockdown seems the best option being thrown around. Fidelis Sukina, National EMTV News.
Drau Hospital in Western Province has seen a decline in COVID-19 cases. Hospital manager Moses Dina said the last death recorded was 3 weeks ago. The trend of cases has declined with 0 to 3 cases recorded on average per day. Dina said the spike of COVID-19 cases was in the month of September with 245 confirmed cases and 6 deaths. The current decline of cases is good news for the hospital as it recoups and prepares itself if cases surge again. Like all hospitals in the country, Drau Hospital also needs more oxygen and medicine to treat COVID patients. It hopes it can procure all the hospital needs as it slowly prepares the hospital to resume normal services. PNG will benefit from a 13 million kina grant assistance from Japan. Foreign Affairs and Trade Minister Soro Eoe and Japanese Ambassador to PNG, His Excellency Kuniyuki Nakahara, signed the instruments to effect this. The grant assistance will be utilized on roads in 4 provinces in the country.
Road is an important infrastructure to develop a nation. The signing today was a testament of the Japanese government to assist PNG. The grant assistance of 13 million kina will see the construction of roads to support critical infrastructure development in West Sepik, Manus, Milne Bay and Enga provinces.
Construction equipment consists of excavators, motor graders, wheel graders, vibration graders, backhoes and dump trucks, and will be delivered accordingly to the aforementioned provinces in due course.
According to Foreign Affairs and Trade Minister Soro Eoe, this is in line with the Marape Basil government's effort towards connecting PNG.
This equipment will help with road construction infrastructure and consistent with Marape Basil government's policy towards connect Papua New Guinea, and meets the goals and development targets as envisaged in Medium-Term Plan 3, 2018 to 2022, and Vision 2050.
Japanese Ambassador Kuniyuki Nakahara says the signing is the outcome of a meeting between former Japanese Prime Minister and PM Marape early this year.
Prime Minister Suga made a commitment in the meeting to provide further grant assistance of 24 road construction equipment. It is my sincere hope that this grant assistance, together with the technical cooperation, will make a considerable contribution to PNG's national endeavor to upgrade road networks and contribute towards fostering the further friendship between the people of Japan and Papua New Guinea.
Ambassador Nakahara says he is confident that the money will be well utilized. Podivai National EMTV News.
A new short documentary has been released by American Nathan Puff, who grew up in Nali village on Manus Island, where his parents Jerry and Sue Puff worked as Bible translators for 34 years. Nathan's parents departed for the U.S. recently due to the COVID-19 pandemic. Nathan's father Jerry eventually died from a respiratory illness, but their work has been inspired in the documentary produced by Nathan.
On March 19, 2020, one day before Papua New Guinea recorded its first positive COVID-19 case on March 20, a historic launching ceremony took place in Nali village, Manus province. Half of the New Testament in the Holy Bible, which had been translated into the Nali language over 34 years, was finally ready for distribution and use. Jerry Pfaff and his wife Sue had been the drive behind the Bible translation work as translators working under Sama Institute of Linguistics and also training some people from Nali to help out. The Pfaff family had to return to their home country, the United States, shortly after the launching due to the COVID-19 pandemic. Jerry eventually passed on a few weeks ago from respiratory illness. Nathan Pfaff, son of Jerry and Sue Pfaff, who grew up in Nali and now works in the field of filmmaking in the United States, has produced a short documentary on the Bible translation launching ceremony depicting the family's time spent on Manus Island. He spoke to MTV News via a Zoom interview earlier this week from California in the U.S.
My parents went to Papua New Guinea in 1987, so over 34 years ago, and they started working with the Nali people in Manus province in Papua New Guinea, translating the Bible into the Nali language. And so it's been a long process, but they got some of the Old Testament, the book of Genesis, translated in 2008. And then they did some audio recordings so people could listen on audio players in the villages using solar panel audio devices. And that was about 2014. And then in 2019, they translated the Luke video, a video of the book of Luke, into the Nali language. And then in March of 2020, they had a big dedication celebration getting half of the New Testament printed, published in the Nali language.
Nathan himself shared some of his experiences growing up in Manus province, blending into the culture of the local people as his parents focused on the Bible translation program.
Portions of other parts as well. They just haven't been finalized and finished. But yes, my mother would love to come back to PNG and help get the whole New Testament printed for the Nali people. So the Nali language group is in Manus province, and it has less than 4,000 speakers of it. But my parents have been helping train a team of local Nali speakers that will hopefully then be able to train and mentor other people from different language groups. So if they also want a translation in their language, then this team of Nali translators will be able to help them. And so they're hoping that it will then spread and they'll be able to get more translation work done.
Despite his father's passing, Nathan's mother, Sue, will continue the Bible translation work in collaboration with the local Nali villagers who have been trained in Bible translation work.
So would you love to come back to Papua New Guinea sometime?
Always. I would always like to go back. Papua New Guinea is my home, so I love it. I think it's paradise, the most beautiful country.
The full short documentary is now available on YouTube following a trailer that was released earlier. Dennis Orere, National EMTV News.
And now looking at the last fund market report, the Kina closed unchanged at $0.2850 in the interbank market. At Bank South Pacific, your Kina is buying $0.2775 $0.3675 Australian dollars, $0.2307 euro, and 31.04 Japanese yen. Looking at commodity prices at New York close, gold is trading higher, cocoa closed higher, coffee and copra closed lower. Crude oil is trading lower, palm oil and copper closed lower. And on the stock market, the Dow Jones closed lower, the ASX 200 is trading higher, and the Ordinaries is trading lower. National EMTV News continues with more stories after these messages. Stay with us. Welcome back to the news. The Iglesia Ni Cristo Church in Papua New Guinea today made a donation to the National Capital District Commission as part of the Aid to Humanity program in the city. The donation of 350 bales of rice and 200 plus boxes of canned food and noodles will be distributed by NCDC to the needy throughout the city.
Like any other city in the world, the residents of Port Moresby face hardships. Even before the COVID-19 pandemic, some city residents have been finding it difficult to make ends meet in the city. Today, one organization that has been present for 44 years in the country, the Iglesia Ni Cristo Church of Christ in Papua New Guinea, through their Aid to Humanity program, donated 320 bales of rice and over 200 boxes of canned food and noodles.
We promise to convene more Aid to Humanity outreach project, not just in Port Moresby, but to the entire Papua New Guinea. As it is written in the Bible po, whenever you possibly can, do good to those who need it. That is written in Proverbs 3:17.
The Church of Christ has been giving alms to fight poverty across 33 countries, and their efforts in Papua New Guinea have been praised by the governor of NCD, Powes Pakop.
On this note too, I want to thank the church for your 44 years of mission in our city and in our country, not just in spreading the good news, the gospel of Christ, but importantly, all the other social missions that you all have been undertaking in these 44 years.
Governor of NCD Powers Pakop was grateful for the kind gesture and says they will find a way to distribute the food throughout the city of Port Moresby to those that need it the most.
Work out a process to identify the most needy people who deserve it. Maybe following their queue, they've been to the hospital and to some of the villages and communities in the settlement and even some suburb too. So we'll work it out. But at this time, we have not come up with a process yet.
Fidelis Sukina, National EMTV News.
Trukai Sports is next. All the details after the break.
Trukai Sports.
Welcome to Trukai Sports. The PNG Barramundis ended their T20 World Cup campaign with a loss to Bangladesh, chasing 182 runs for victory. PNG were bowled out for 97, falling short by 84 runs.
Bangladesh completed a dominant win over the PNG Barramundis to become the first team from Group B to seal their place in the Super 12 stage of the Men's T20 World Cup.
It's a biggie.
Having posted a challenging 181 runs with a loss of 7 wickets, Bangladesh bowled out PNG for 97 runs. The 84-run win, their biggest ever by runs in any T20 match.
Shakib, it's one-handed.
There were several heroes for the Tigers, with Shakib Al Hassan leading the charge, scoring 46 runs with the bat, after which he ripped through the PNG lineup, taking 4 wickets.
And it's wide and it's...
PNG, playing in the debut World Cup, impressed with their fielding.
That's the catch of the week.
Kipling Doriga, with his 46 runs, was the only batsman for PNG who looked in good touch.
No, it is.
The rest of the Barramundis batting lineup were unable to withstand the Tigers' bowling attack, with PNG only scoring 29 runs with the loss of 7 wickets inside 11 overs. The Barramundis crumbling under the pressure applied by the experienced opponents. Huxley Lovai, Trukai Sports.
And that ends Trukai Sports. There were the details coming up next.
Trukai Sports. Trukai Sports.
This weather update is proudly brought to you by MoniPlus, with you always.
I'll look at the weather forecast in the southern region. Mostly fine in Port Moresby, Drau and Alotau. Brief showers in Kerema and cloudy with a shower or two in Popondetta. In the Mamasa region, partly cloudy with brief showers in Ley and Medang. Cloudy with some showers and possible thunderstorms in Wewak and Whanimore. In the New Guinea Islands region, cloudy with showers and thunderstorms right across the region. And in the Highlands region, partly cloudy with a few showers and possible thunderstorms in Mount Hagen, Mendi and Wabeg, and partly cloudy with a few showers in Goroka and Kundiawa.
Weather update was proudly brought to you by MoniPlus, with you always.
And that's been the news, sports and weather for today, Friday, 22nd of October 2021. Until next time, pleasant viewing, be safe and good night.